Introduction wise, my name is Ben. I'm the business development manager here at Thrive Tribe. On the call, we've also got Dr. Richard Pyle. He's our medical director and also a registered GP. Wave, Richard.
Good afternoon.
We've got Tom Shirley on the call. He's another business development manager here at Thrive Tribe and also acting as the interim head of service for our new City of Hackney stop smoking contract.
Afternoon, everyone.
And we've got Tilly Peck on the call. She is our marketing manager and she'll be overseeing the slide deck, and she's actually organised this nice event today for us as well. So give us a wave, Tilly. Perfect. So while we're all here today, we're going to look at our new stop smoking service for Cardiology, City and Hackney. The running order for the day, I'll start off with a very brief overview of the session. Can I have the next slide, please, Tilly? I'll do a little bit of a run through about Thrive Tribe, our background, why we're all here. So for those of you who haven't heard about Thrive Tribe, we're a leading healthy lifestyle provider with a proven track record. We have contracts ranging from stop smoking only contracts, weight management contracts, and quite a few integrated healthy lifestyle contracts. We have 7 national diabetes prevention contracts, and we're also now a provider for the NHS digital tobacco treatment service. So a lot going on at the moment. We've been chosen to deliver the new stop smoking contract in City and Hackney, which went live on the 1st of July. So we're now into that phase where we're actually a delivering provider. We have award-winning programs that focus on particularly looking at long-term behaviour change and how we can kind of create a habit. And to date, our stop smoking systems have helped 114,000 people to quit smoking, something that we're really proud of, and that number is always increasing. Next slide, please, Tilly. For today's session, in a few minutes, I'm going to hand over to Dr. Richard Pyle. He's going to talk about the benefits of smoking cessation, particularly the patient, the practice, and the system. That'll take between 10 to 15 minutes. Then we'll come back to myself. I'll kind of go into our new service, a bit of an overview of the service, how to refer into us, what's our inclusion and eligibility criteria, and then a little bit about what's already kind of happening on the contract and how we're kind of co-producing and collaborating with local partners. And then we'll have some dedicated time at the end for a Q&A. As I mentioned, any questions, please put them in the chat, and Tom is on hand to answer them as we're going through. Okay, Richard, over to you.
Thank you very much, Ben. Welcome, everyone. It's great to be speaking to you. Just to briefly reintroduce myself, my name is Richard Pyle. I'm a GP partner of 24 years. I'm also a certified lifestyle medicine physician, and I'm the medical director for Thrive Tribe as well. None of you will be terribly surprised by the title of this talk, and I don't think anyone's joined this today thinking that smoking is actually good for you, but hopefully this will just be a few minutes, and I probably won't need 10 to 15, just to talk through some of the issues around smoking cessation, some of the challenges that you face in your parts of the world, the history of it, and the benefits to our patients when they stop smoking, obviously to encourage you all to refer into the new service. Could I have my next slide, please? So there aren't too many people on the call today, so you're very welcome to perhaps stick your answers in the chat, make it a bit interactive. Who is this person in the picture? Do you have any ideas? I've put a bit of a clue there as regards the date. This is your chance to demonstrate your historical knowledge. It is, of course, specifically around the issue of smoking and tobacco, so that might be an extra additional clue. Have we got any answers that you'd like to share with us? Some of you must be history buffs. Silence at the moment. Recently, Sir Walter Raleigh, good shout. Well done, full marks. So I don't know whether you've ever listened to it, but recently Bob Newhart, who was a fantastic comedian, passed away at the age of, I think, 94. He was very famous for a number of sketches he did, including The Driving Instructor, but one of his funniest sketches, along with The Driving Instructor, was introducing tobacco to civilization. If you ever get the chance to listen to it, you'll probably find it on YouTube. It's utterly brilliant, and it was basically making fun of the fact that it's a really bizarre concept, and the sketch is built around the idea that Sir Walter Raleigh is on the phone from the colonies back to his boss, talking about tobacco and what on earth it's for and the uses that you've got for it, including, weirdly, setting fire to it and inhaling it. If you think about it, going back to that time, it is a really bizarre concept. We're now at what, 440 years on from there. And even in those days, it was controversial. This picture illustrates I don't know whether it's true or not, but the commonly told story that his page boy, on seeing Sir Walter Raleigh apparently on fire, rushed into the room and attempted to douse him with water, which I'm sure went down very well at the time. Can we have the next slide, please? But even in those days, it was controversial. You had physicians. Now, okay, there were all manner of physicians in those days, and the route by which they called themselves doctors were perhaps more variable than the standardized ones we've got nowadays. But we had people writing about the virtues of tobacco, recommending it for, please make a note of this, toothache, fingernails falling out, worms, lockjaw, bad breath, and most interestingly, cancer. Apparently tobacco was recommended as a cure or treatment for cancer. Probably the evidence base for that not quite so strong nowadays. But equally, there were other people who clearly from the offset thought it was a very bad idea, even if it was just morally opposed to it, before never mind on health grounds. And I love this quote from King James I: "A custom loathsome to the eye, hateful to the nose, harmful to the brain, dangerous to the lungs, and in the black and stinking fume thereof nearest resembling the horrible Stygian smoke of the pit that is bottomless." So one can imagine that King James was probably not a big fan of smoking. But nonetheless, it's been with us for a long time now, which I think reflects why it's still such an issue. Could I have the next slide, please? So the thing that we should remember, and I say this in slight jest, but also not jest, smoking is the original and the best, or should I say original and the worst behavior or risk for your health. Because of course, think about it, everything else that we talk about, when we want to say how bad things are for you, what do? We compare it to smoking. So inactivity is the new smoking. Eating crap food is the new smoking. Being obese is the new smoking. Alcohol and smoking, both pretty bad for you. And of course, loneliness, that's the latest thing. I recently gave a TEDx talk, he says on it, shameless plug, you can find it on YouTube if you like, about the harms of loneliness. Loneliness may decrease your life expectancy by as much as 30%, and smoking is compared to loneliness. But the other problem with this, of course, is that it's not an either or situation. These are not a list of vices, or not even vices, because that implies being a bit judgmental, doesn't it? These are a list of risks, health risks, that you don't just pick from them. People don't go, well, I'll tell you what, I'll have the smoking one, but not the obesity one. Because in reality, as per the Amazon illustration I've put here, these are often connected together. When you go to Amazon and you buy running shoes, you'll get a message which goes, people who bought running shoes might also like to buy resistance bands and packets of protein powder. Well, of course, people who smoke are often socioeconomically disadvantaged. They don't just have one bad habit or lifestyle risk, they've got others. They're probably also overweight. I'm generalizing slightly, but they may also be drinking more than is good for them. They may well do a manual job with potentially exposure to an environment which is not good for them. They could be more likely to be lonely depending on their age group as well. So all of these things, it's not that smoking's bad for you by itself, but of course these things are often compounded. So we should never forget, in our drive for obesity management, etc., with all these drugs coming out that you can now be prescribed, that smoking is the original and the worst, and for many countries it still remains one of, if not the leading cause of death. And we know that prevalence is decreasing. That's because of all the good work that we've been doing over the last few decades, ever since it was first shown that smoking was bad for you. But it's still there. And in fact, you could argue that the people who are still smoking after all the work that's been done are the ones who are going to need more help, who are going to be those tougher nuts to crack. And in Hackney, according to your public health data, smoking prevalence is at least 14%, which is apparently about 29,000 people. And so clear, and not, although prevalence has decreased, it's stalled over the last few years. So we seem to have got a bit stuck. Hence our ex-government, and are doing something which I hope will be kept to with the new government, which is, for example, prioritising the health of young people and raising the age of sale for cigarettes. So there'll be many people in this country who, if from 2027 onwards, who never get the chance to buy a packet of cigarettes, at least not legally anyway. Next slide, please. But when we talk about the benefits of stopping smoking, you can often imagine it might not be all that appealing to some people because they're only going to really know the benefits years or decades down the line from now. And actually, we know as humans, we're a bit rubbish when it comes to that. The concept of delayed gratification and the concept of what would my 70-year-old self thank me for having done, it's a bit hard to get your head around as a mind exercise. And because people feel that there may not be a short-term benefit, it's a potentially harder sell. But actually, there are short-term benefits. When I did my cardiology diploma, I had a lovely consultant cardiologist mentor who was very generous with his time. I used to sit in clinic with him and see patients with him. And he used to say to them, every time you smoke a cigarette, your blood becomes more sticky. And in that moment, your risk of having a heart attack or a stroke is increased. And that remains true. But we can see short-term benefits quite quickly. So, for example, after 20 minutes, the pulse rate decreases. And you can share this with the people that you're promoting smoking cessation to. Within a couple of days, the levels of carbon monoxide are clearing out from your body, and with the associated improvement in smell, etc. Within a matter of weeks, you're going to find that your circulation will be improved. And after a year, your risk of heart attack is halved compared to that of someone who's still smoking. I mean, that's quite a big deal relatively quickly. And then there are other benefits as well. So, for example, your oxygen levels improving, your breathing feeling easier, and your lung function increasing over the next few months. Now, I should acknowledge, you've probably all heard people say this. Sometimes people who've stopped smoking say, oh, I don't know why I bother giving up smoking. All I've done is cough for the last 3 months. I might as well take it up again. I quite enjoyed it. And now I'm, feeling worse. But of course, that's because, as those of us who've had a bit of medical training know, the parts of our body that were being suppressed and damaged by the smoke, the cilia, for example, the hairs that line our airways, they're coming back to life. And they're starting to do their job, and they're clearing all the gunk off people's chests. So I often encourage my patients and say, stick with it. It's a sign actually that good things are happening and things will improve. And of course, lung function doesn't improve straight away. But after 10 years, your risk of lung cancer is half that of a smoker's. So these benefits can all be felt, some of them relatively quickly. Next slide, please. And I just wanted to finish off with this slide because this is really where I wanted to emphasize the power of change, of what we might loosely term lifestyle medicine. And by that, I don't mean a medicine which a very few privileged, middle-class, quantifiable selfers who listen to podcasts and can buy fancy food are privileged to practice. Lifestyle medicine is something that we can all do. We can all have a degree of control. We can all take steps in our lives, even if it's just one thing a day that we can do differently. And smoking cessation, as you'll see on this table here of the red, amber and green, is one of these things that we can all do for ourselves, and of course with support from others. The reason I've coded these red, amber and green is because the top things on the list are essentially drug related, are things that we're advised are evidence-based and noble and worthy, and we get boxes ticked by doing it as GPs and nice like it. But in reality, the numbers need to treat are distressingly high and the improvements disappointingly small. Please don't get me wrong. I'm not, as a GP, saying stop taking your clopidogrel to prevent your recurrence of stroke. I'm not, as a GP, saying that no one should ever have a statin, although it should probably only be the people who are really high risk and have had heart attacks and strokes already. And I'm not saying don't ever treat blood pressure. Please don't take that message away. But the reality is that you have to treat over 217 people for 5 years for one of them not to have a heart attack. The other 216, no benefit in terms of that event, that outcome. It's more for stroke. You have to treat 313 people for one of them not to have a stroke. And even for secondary prevention, if you take your clopidogrel, having had a stroke, which of course is best practice, you have to treat a lot of people to either prevent a recurrence of that stroke or a death from a heart attack or a stroke. And rather disappointingly, when it comes to blood pressure, if your blood pressure is only mildly raised, and this is where I risk slightly upsetting people who go around finding people with hypertension in the community that weren't known before, for those people that are found who only have mildly raised blood pressure, you don't actually save any lives by aggressively treating their blood pressure. You do for a higher blood pressure, but not for mildly raised. And in fact, you only need to treat 12 of them for someone to fall over and break a hip, or potentially to suffer an acute kidney injury. And yet when we move into the lifestyle medicine side of things, let's look at the smoking cessation. Only 15 people need to stop smoking or thereabouts to prevent someone dying. That's pretty good. Let's compare that to the stats for taking a statin for your cholesterol. That's that you may of course do both, but that is an incredibly powerful intervention compared to taking a pill every day, which your doctor prescribes. But we recognize, of course, there is a difference as well between just being handed a prescription pad and then essentially it being someone else's problem and all you have to do is remember to take the pills, compared to giving up smoking, which of course is tough because there are lots of reasons why you might have started smoking, and it is a very addictive habit, both in terms of the habit itself and also the drugs that they take. Of course, the good news is that it gets even better. So if you think that giving up smoking is pretty good, look at how much you stand to gain by losing weight to prevent diabetes or lifelong disability, or for putting your moderate to severe depression into remission, as was demonstrated in the SMILES trial by Professor Felice Jacka. And of course, nowadays, the pathway to remission for type 2 diabetes is commissioned across the whole country. The very low calorie diet, built on the work of people like Dr. Michael Mosley, where for every newly diagnosed diabetic, if they get put onto and comply with the very low calorie diet, they can reverse their diabetes. So I really want to just use this slide to illustrate actually the biggest difference that most people can make in their lives is not the difference that someone else makes for them by prescribing drugs. And that's why we should always be excited by and always continue to strive towards helping people giving up smoking. And of course, that may sometimes, as illustrated by this slide and others, include helping them to address some of the other reasons that they smoke and the other risk factors in their lives. And I know we're focusing today primarily on smoking cessation, but we're a very holistic organisation as Thrive Tribe, and our team members will of course be able to signpost people for the support they need for other things in their lives as well. So I'm going to climb off my soapbox now and hand back to my colleagues to talk a little bit more about the practicalities of the new service. And I'll stay in the Teams meeting to take any questions at the end. Thank you.
That's brilliant. Thank you, Richard. Okay, over to part 2. Let's have a look at our new smoking cessation service. Next slide, please, Tilly. Okay, so what we're actually offering to the patients. We'll do a bit of an overview of the programme as it stands at the moment. As I mentioned earlier, the contract went live on the 1st of July. So we're actually now taking in new patients. We're actually delivering clinics, and we're actually offering smoking cessation support to local residents. Next slide, please, Tilly. What we're actually offering as part of the Glogy Smokefree City Hackney contract is a stop smoking service for anybody over the age of 12 years old, and they must live, work, study, or have a GP in the Borough of Hackney or the City of London Corporation. It's a 12-week programme, and it combines psychology. We're going to be offering quit aids such as patches, NRT, e-cigarettes to patients' doors so we can ship directly. And we'll be offering support through the fully trained NCSET level 2 as a minimum qualification level, friendly stop smoking advisors. We'll also have interactive videos and online tips, tricks and guides to help support everyone on their journey. What we're looking at doing is working with healthcare professionals and organisations in the local area to reduce the number of smokers in City and Hackney. That's our primary goal. Next slide, please, Tilly. Okay, so how does it work? Essentially, anybody that gets sent through to our service will come through to our triage system. So whether they're a healthcare professional referral or they decide to self-refer into us, they'll all come through to our same central point of contact. That's our triage. And then they'll be offered a choice. They can do face-to-face support or they can do remote support. So if they come through to our face-to-face support options, they'll get one-to-one face-to-face appointments with a fully trained stop smoking advisor, and that'll either be in GP clinic settings, it could be in community settings. We're kind of embedding ourselves in the local area, and we're also working with local pharmacies, so we can have pharmacy provision as well. Everyone will have access to free NRT, so it could be patches, gums, lozenges, or they could have e-cigarettes. They'll have regular check-in sessions throughout their 12-week programme from a very understanding and empathetic advisor. So that's option 1, face-to-face support. Option 2 is a remote telephone support. So we've kind of realised now, following off the back of the pandemic, that more people are quite interested or want a remote support. Not everyone wants to go face-to-face now for some of these kind of services. So we're offering a flexible one-to-one telephone service. These will be telephone appointments that fit around the patient's schedule. So it could be daytimes, evenings, weekends. We'll offer support that will work around that. It'll be a telephone call. And again, the same free NRT is now delivered directly to the patient's doorstep. Again, that applies for the vapes as well. And that is a flexible approach. They can kind of choose how frequently they want to have their telephone calls. Again, all by a qualified NCSET Level 2 advisor. Next slide, please, Tilly. In addition to either of those routes, either face-to-face or fully remote, everybody gets access to our fully digital support platform. It's called Glogy, and it's a digital web app. And that provides 12 weeks of digital content and support. So it's got videos in there, it's got tips, tricks, guides about temptation, crushing the habits, cravings. It's also got access to our online gym and our recipe book. So as Richard mentioned, we know that a lot of people that have a habit of smoking might also have other lifestyle interventions they want to try and work on. So they might want to become more physically active. They might also want to look at their diet. So in addition to the stop smoking support, they also get access to an online gym with over 200 exercise classes. And that's kind of anything from low impact and chair based up to some more vigorous and energetic activities, and lots of recipe books to try and get everyone to lose a little bit of weight and have a bit of varied diet as well. At the bottom, there's a few examples there of our web app. So on a mobile platform, and on a desktop, we've got downloadables such as our quick journal on there. It's got a quick calendar. It's got, again, triggers, cravings, loads of wonderful topics that the service user or patient can work through week by week. Next slide, please, Tilly. Okay, so how can we refer in? How can residents join our Glogy smoke-free service? Okay, so there are a few different options. Option one is your clinical operating system. So the easiest way for healthcare professionals to refer in is through EMIS. So we've embedded our referral form now into EMIS. So if you go on EMIS, it should automatically populate the vast majority of our referral form. You can submit that and that'll come directly through to our secure NHS mailbox, and that'll get them picked up by our triage team. Option two, you can submit a referral. Again, that can be done by a healthcare professional, and it's just a downloadable form, very similar to the one that will be on EMIS, but this is a little more that has to be filled in manually. Again, that'll come to the exact same spot through to our NHS mail account, which is on the bottom screen there. We'll share it at the very last slide as well, so everyone can make note of that. Or the third option is patients can self-refer. So if someone sees our marketing material or is interested in stop smoking and they kind of Google our website, there's a button on there that says get started, and they can fill out a self-referral form. Just ask them a couple of questions to make sure they hit our eligibility criteria. And again, away they go, and everyone comes through to that same central point of triage, and then they'll get their first appointment booked in. Next slide, please. Okay, so we mentioned eligibility. What's our inclusion criteria? So anybody that's over the age of 12 and older, and again, they have to live, work, study, or have a GP in the City of London or in Hackney. They have to be a current user of a tobacco product. And quite importantly, they have to be motivated to quit and reduce that tobacco usage. So they have to be the right frame of mind to actually start a quit attempt and follow it through using that specialist support service through our 12-week program. Next slide, please. Our exclusion criteria is, unfortunately, we're not able to take anybody under the age of 12 years old. And there's also a few caution groups, particularly around pharmacotherapy. So what we can and can't prescribe, I think people like those with unstable cardiovascular diseases, those women that are breastfeeding. There are a few pharmacotherapy options that they can and can't have, but that's at the discretion of NICE guidance. And that is also something our advisors are trained in prescribing. So again, if someone comes through, we'll have that conversation with the patient. Next slide, please. Okay, so working together. As part of our contract in City and Hackney, it's really important that we work with the local community, with the infrastructure. So to work out what's already been happening in previous contracts, what's already existing, who we can work with as partners, and how we can work together to kind of benefit the residents to quit smoking as part of our service. Next slide, please, Tilly. As part of that, our commissioners and our contract has identified a few priority groups. We've kind of elaborated on that a little bit. So we know that in City of London and in Hackney, that smoking prevalence is highest in those groups of socio-economically deprived communities. So those areas that maybe IMD1, areas of deprivation. We know access to quitting smoking is a little bit harder for them, and smoking rates are usually a little bit higher as well. Same goes for those routine and manual workers, people living with poor mental health, and those living with long-term health conditions. We also know that smoking in pregnant ladies is a key priority in the area, so that's something we're focusing on, and those from the LGBTQIA+ community as well. In addition to this, we're also working with those with substance misuse and those experiencing homelessness. So they're kind of our key priority groups. And then in addition to this, we've also identified a couple of global majority groups in the area, where we're going to look at working with the Turkish, the Kurdish and the Cypriot communities, the Black Caribbean and the mixed white Caribbean community, those from Bangladeshi, Eastern European and Vietnamese communities as well. You'll probably see at the top there, we put the big word co-production. So this is something that Thrive Tribe does really well. And for anyone that's not heard of co-production, it's a way of working where we put the service users' needs at the forefront. So we know that the groups on the screen here are potentially harder to engage groups, harder to reach and get into our services, whether that be stop smoking, weight management, or physical activity. But particularly for smoking cessation, engaging these population groups is quite tricky. So what we do in a co-productive manner is we gain insight from those with lived experience or past lived experience. Those might work in organizations or charities with the particular groups. And then we'll put together a bit of a focus group or a steering group for each of these populations, and we'll have a conversation. We'll say our overall goal is to reduce smoking prevalence in this group, and we'll discuss it. What are the barriers? How is it prevalent in this community? What's been tried before? What's not worked? And ultimately, what would they like to see as a stop smoking intervention? And then we can work together and we can kind of put that into practice. And from past experience on other contracts, we know that's got a much higher success rate of engaging these groups that are traditionally harder to get into our services. And that's already started. So I mentioned we started our contract on the 1st of July. We've already started having conversations and we started forming focus groups with a couple of these project groups already. And that work will continue throughout the lifetime of our contract. Next slide, please. Okay, our nearest clinics. This is where I'm going to borrow the screen, Tilly. I'm going to just share my screen and I'll show you a little bit of an interactive map around what I've already got in place. Okay, so hopefully everyone can see my screen now. It should be a nice blue map of Hackney and City of London. We've set up clinics in the community. The orange dots here. So this is where we're already kind of delivering our clinics and we're looking to expand on these all the time. These community ones are more embedded in those hard to reach areas, form almost like a drop-in clinic with our advisors. We've got clinics running out of GP surgeries, which are the pinky orange dots on here. Now, when it comes to working with our GP surgeries, we have a fantastic relationship working with GPs. We generally use clinic space and we bring in our advisors. And as an added benefit to working with GPs, we can actually update their system and that can support their quad points as well. So it's a really positive relationship working out of GP clinics. We're also working with local pharmacies. So all the yellow dots here are the pharmacies that are currently signed up to work with us on the Globally Smoke-Free contract. With the pharmacies, we work with pharmacy staff who are NCSCT level 2 trained. We put together a really quite generous pharmacy tariff to make sure that everyone gets paid adequately for supporting our service. And what we'll do is we ask the pharmacies to update Quick Manager. So if anybody on the call today either works at a GP clinic or they might work in a pharmacy and they'd like to get involved with our service, that's absolutely an option. If I just hand back to yourself now, Tilly, I'll put my email address on the screen. So if you've got space in your GP clinic, or if you've got a pharmacy that's not currently on that list and you'd like to work with us, please do get in contact. Tom's just dropped in my email address in the chat there. So it's ben.middleton5@nhs.org.uk. We have got a service level agreement. I can provide you some more information on the tariffs or how we kind of work on the GPs to support the QOF points. But yeah, do reach out to us. We'd love to hear from you. Okay, and that map we kind of went through a few minutes ago, that is our initial map, and that will expand in both the community, hopefully GPs and pharmacies as the contract goes on. Okay, marketing materials. So we're live, we've got referrals coming in, and we've got clinics seeing our patients. We've got marketing materials out and about in the community, and if you've got space in your venue, be it in the community, in a GP or a pharmacy, and you'd like to have some of our resources, please do get in touch. Here's a nice example here of one of our A5 leaflets. You can see on the front there, really clear, Glody smoke free. Again, it fits nicely with our branding. It also mirrors very nicely to our website as well. So if you look at that one, and it's got some really simple call to action points. We've got the phone number, email address, and a website. And then for anyone who's a bit more tech savvy, we've got a nice QR code that takes them straight through as well. On the reverse, we've got information about what you'll get when you join up and our criteria for joining. So yeah, really easy, user friendly. If you'd like any of our marketing materials, do get in contact. Please put the form in our chat now, so you can reach out to us. Yeah, we can have that sent out to your practice, to your location. Okay, what happens next? We are live, as I mentioned, so please do refer into our service. Refer. They'll come through to our central triage point, and then we'll get them booked into their initial appointment. If you'd like to work with us in either a community setting, it could be a GP setting, or as a pharmacy, get in touch and we can reach out to you and we can have a conversation around how that might work. And likewise, if you have any questions, get in touch with us or feel free to put them in the chat, or we'll have a few dedicated minutes at the end of the session to run through a bit of Q&A. Next slide, please, Tilly. Okay, so here's our information. That's our phone number. We have a general inquiries email address as well. So it's just cityofhackney@glogy.co.uk. Our referrals email address is the nhs.net one. So anything you send through EMIS or through a healthcare professional referral will come through to the NHS account. And yeah, that is our website at the bottom. Please do check us out. It's smokefreecityhackney.org. Any questions? I'm going to hand over to Tom now, who can answer any of your questions. Hopefully you find that an informative session. Thank you for coming on the call. We really appreciate it. And yeah, we look forward to hearing from you and hopefully working with you in the future.
Thanks, Ben, and thank you, Richard. Shazia, thanks for your question in terms of how we'll get a copy of the slides. So everybody who's attended will be sent a copy of the slides and the recording. So that will be organised after the call. I believe they'll be emailed out, but Tilly can inform us if there's anything different. I can see there's a couple of other people typing, but we'll hold on for a few questions if anybody does have anything. If not, thank you for coming, and thank you for the comments in the feed as well. So Joseph, thanks for your question in terms of if support's available for people exclusively vaping and want to quit. Vaping will be a part of the service, and it's something that's probably going to be coming a little bit later. So in initial stages, we're focusing on those with tobacco, but vaping is something that will be a focus and will be built out. So as that starts to be developed, we'll be putting out further information and further communications to healthcare professionals across the picture in Hackney. Should say across Hackney and the City of London. I'll definitely be told if I don't do that. Obviously, we are covering both areas. I can see there's one or two more people still typing, so we will hold on. Another question from Shazia. Revaping, will that be a part of the contract or just the development of your service? So it is part of the service, it is part of the contract, but it's something which is to be discussed with commissioners and built in as we go along. So yeah, it's to be developed, and as I say, we'll definitely pick that up and have it as we're aware it's something which is prominent across the scene at the moment. That's great. Thanks, Shazia. Okay, I can't see anybody typing now, so I will start to wrap things up and say thank you to all of those who've come and joined us today. If you do have other questions, then please do feel free to send us an email. The contact details are in the chat. Pick up the phone, give us a call, or reach out, and we can send somebody across to come and speak in person. So we've got a team who've hopefully you've seen them out and about at the various practices, pharmacies, and other areas, and we'll be continuing to do so over the next few weeks and months. But yeah, thank you for joining us, and thank you again, Richard and Ben.
Cheers, everyone.
Thanks a lot.